Um, Earlier you said that carb intake does not affect milk production, but will carb less than 210 per RDA affect milk production?
Yeah, so meaning what we're talking about is the 210 grams of carbs is what we need to support the mom and the baby in different terms. Yes, when you actually bring down the RDA of 210 to, let's say, maybe 130, it does in turn bring down the total calories too. So when I talk about carb intake, is not really affecting the concentration of milk production. You mean to say when I'm talking about it has to be way higher carbs for the sugar concentration in the milk to go up. But when we're talking about the RDA for 210 grams, that is a support we're giving in terms of calories for milk production. So yeah, if you really bring it down to half of the RDA, you're bringing down the calories and it would affect the milk production.
Okay, thank you. Okay, next one. This is actually more of a comment. I have women who substitute 10 minutes of exercise for every feeding they drop in weaning.
Yeah, that works. I mean, it's like, I would say as soon as you start weaning, if you want to kind of maintain, some people try to maintain the same calories, but if you start adding, but typically I say when you actually wean off, you definitely have to cut down your calories at the same time, adding in exercise together, kind of eating right, putting in exercise, blend in together. But definitely, hey, yeah, if you can add in 10 minutes of exercise every feeding, they drop in weaning, that works. Yep.
Okay, I have a couple that came in after I put the slides together. So, and we have quite a few on fenugreek. We've heard that fenugreek causes hypoglycemia. Fenugreek increases, does fenugreek increase breast milk production? Can you address fenugreek and the potential side effects? And then fenugreek, oh, that one's a repeat. Yeah, can you address, I guess, in general, fenugreek?
Yeah, so I think that's an excellent question because I do get a lot of questions on fenugreek coming especially from the Asian culture, from women from Asian culture. Fenugreek has been very well researched about its benefits due for diabetes. Yes, it does help. I don't know the exact mechanism, but it does help in bringing your sugars down. So yeah, you have to be careful with hypoglycemia. So a lot of Asian culture does give fenugreek to increase production, and they talk about fenugreek being heat, like the yin and yang too. So if someone is taking fenugreek, yeah, you want to be monitoring your sugars. So it depends on how much you take. So normally people ask me how much. I would say if it's about like a teaspoon a day, that does help you with that. Yeah, but it definitely helps with the glucose control. You have to be careful about the hypoglycemia. But like I said, if you're doing like about a teaspoon a day, I haven't come across where it could actually cause any hypoglycemia.
Okay, thank you. Okay, so it is 10 minutes after 1. Do you want to keep going or do you need to stop? Anything that we don't answer? Anything that we don't answer, I'll email. Okay.
Okay, I can take about a couple of minutes in.
Okay, then you tell me when you need to go. Okay.
Okay, so maybe like about 1:12, another 2 minutes, 3 minutes.
Let's see, I've read a couple of studies that suggest that breastfeeding can work as birth control if baby is nursing in short intervals, no more than 3.5 hours. So this is just another comment. No more than 3.5 hours between feedings.
Yeah, it does, because the research shows that if you are exclusively breastfeeding and on demand, so if someone has to be exclusively breastfeeding, there is going to be many times of breastfeeding. And so I would assume, yeah, no more than 3.5 hours of feeding in between time. So that does, yes, increase infertility rate. So it could be used as a birth control, but like I have said always, I've had some women who've gone through that and they've surprised me. They've come back and they're pregnant. So I would still use birth control when they are still exclusively breastfeeding. Yeah. But that's a good, very good comment.
Thank you. Wouldn't formula reprogram the eating centers in the brain as breast milk would? As breast milk would be the norm.
Yeah, the formula does, I think we did talk about it in one of the slides, the formula does reprogram the eating centers in the brain because once the formula comes in, there's a lot of insulin coming in, secreted, so it does, it does reprogram in the brain to, it increases the adiposity and it does increase the risk for diabetes and obesity. Yes, it does reprogram.
Great. Thank you. Let's see. Do you know if the sugar content is higher in uncontrolled diabetic mom's breast milk? If so, does it affect the infant's growth and development?
That's an excellent question. Yes, the sugar content would be more if it's uncontrolled in the diabetic mom's breast milk. So that's one of the things that we talk about, especially in the third trimester too. So that's why we talk about perfect, especially in the third trimester, to have a really good tight control on the sugars, because if you had a hypoglycemia most of the time, it needed a lot of insulin to control a medication, and your sugars are not controlled. If it's a type 1, type 2 diabetic, the sugar concentration is higher, and it does pass it on to the baby. So the sugar concentration being higher in the breast milk, it might put the baby at risk for increased risk for weight, obesity during the lifetime, yes. And unfortunately, we're pushing for breastfeeding. At the same time, if the concentration is higher, yes, it does affect the growth.
Thank you.
I've got one more minute,
okay.
couple of minutes.
Let's make this one the last one. Anything that's left, we will email. Were the Sweet Success recommendations for normal fasting blood glucose 60 to 89 and 100 to 129 1 hour postprandial only for GDM patients or for all diabetic patients?
So this was given across the board. So it is, so the recommendations during breastfeeding is about 72. Let's see, go back, and so it is the say 72 120, I believe. That's what I put in. Give me just a second. It's the same across type 1, type 2, or the GDMs as well.
Okay.
Yeah. So it's about 72. I would say about 120 fasting, and then it would be about 150 to 155, which we talked about, 1 or 2 hour postprandial.
And once again, thank you so much, Geetha, and I really appreciate it. I learned a lot. Thank you.
Thank you. Thank you all for joining it.
Goodbye, everybody.
Goodbye.